andropausespecialist.com, Section 2, Testosterone Therapy. Low testosterone levels. It's a fact that low testosterone can affect both men and women. You can get your level measured by taking a simple blood test, but a specialist is needed to interpret the results since tests may appear superficially normal even though testosterone levels are low. It's necessary for a medical professional to diagnose a problem with low testosterone. Symptoms of low testosterone can be similar to many diseases and conditions, so a medical professional is needed to identify the issue and recommend treatment. The doctor will look at the test results in conjunction with physical symptoms. Some of those symptoms are low sex drive and impotence, fatigue or decreased energy, loss of muscle mass and strength, fat accumulation, depressed mood, increased risk of osteoporosis and bone fractures, and increased risk of cardiovascular disease. Low male testosterone. What's the best way to measure your testosterone level? Opinions vary, but it is well accepted that if your testosterone level is below 200 nanograms per deciliter, it's considered low. If it's over 600 nanograms per deciliter, then low testosterone is probably ruled out. The analog-free testosterone method is the most widely used by large commercial U.S. labs. We feel that a more accurate measurement is either free testosterone or bioavailable testosterone done in a specialty laboratory setting. While there is some variation in what tests should be used, it's widely accepted that blood work should be done prior to 10 a.m. to capture peak values. Low female testosterone. The medical community has only begun treating women with testosterone therapy fairly recently, and there is little research available. That's why there's little agreement about what normal testosterone levels are. If a woman goes to a general physician and is told that her testosterone levels are normal, all that means is that they are in a range of women who are not ill. It does not mean that the levels fall into a range that women need for optimal health and functioning. But experts in the field are doing research, testing various levels with women, gathering anecdotal evidence, what women are telling them, and sharing the information with each other. Due to this, normal levels are being established even though there is still some debate about the limits for different ages. Each specialist in the field might have a slightly different range and may use different measurements for diagnosis, including total testosterone, bioavailable testosterone, free androgen index, or free testosterone. If a woman wants her testosterone levels tested and she'd like to better understand her sex drive, she needs to consult a female sexuality specialist. It is important to have a specialty laboratory test the hormones and to use the same laboratory every time the blood is tested. Studies show that lab results vary from lab to lab and, in some cases, within a lab from test to test, specifically when dealing with testosterone. You really need to have a laboratory you can trust testing your blood, as the percent and level of increase is as important as the initial levels themselves. Low testosterone and cardiac health. Cardiovascular disease, CVD, refers to diseases of the heart and blood vessels. Examples of diseases in this category are congestive heart failure, coronary artery disease, angina, high blood pressure, and stroke. Cardiovascular disease, in many cases, is caused by arteriosclerosis, an excess buildup of plaque on the inner wall of a large blood vessel which restricts blood flow. In a small observational study comparing men presenting for scheduled angiography, testosterone levels were significantly lower in males with coronary artery disease compared to men with normal coronaries. Reports tell us that testosterone that is acquired from outside the body's own testosterone-making system, exogenous testosterone, is associated with a reduced risk of cardiovascular disease and more favorable levels of certain risk factors for heart disease. However, the relationship between the development of cardiovascular disease and serum testosterone levels remains uncertain. Elevated lipids and apoproteins in the blood are risk factors associated with cardiovascular diseases, in particular high total cholesterol and high LDL, low-density lipoprotein. These lipids are proatherogenic. They may form deposits in the walls of the blood vessels, whereas HDL, high-density lipoprotein, is protective against these deposits. There is a more consistent relationship with testosterone and other lipid fractions. The good news is that when elderly and hypogonadal populations are studied, total cholesterol, LDL, and apoprotein go down when patients are treated with exogenous testosterone. A study measuring the effects of testosterone replacement on lipid levels in the hypogonadal population showed reductions of up to 22% in total cholesterol and 15% in LDL. High blood pressure, hypertension, is another established risk factor for coronary artery disease, and lowering high blood pressure reduces the risk of cardiovascular events. Interestingly, testosterone levels are lower in men with hypertension than in men with normal blood pressures. This may be because testosterone causes dilation of the blood vessels by reducing peripheral vascular resistance, therefore lowering blood pressure. Patients with vascular disease try and lower the incidence of repeat problems, thereby prolonging their life and helping the quality of their life. Secondary prevention efforts go a long way toward accomplishing this goal. Now, there are well-established therapies for coronary disease that target the known cardiovascular risk factors. There is a lot of evidence that suggests that testosterone treatment in men has potentially beneficial effects on virtually all of the coronary risk factors and helps the quality of life in patients with symptomatic coronary disease. This is important since it is rare that a secondary prevention treatment can make a patient feel better. Low testosterone and bone health. When you're young, bones grow in length and density. As a teen, you reach maximum height, yet bones continue to grow denser until age 30. At that point, bones slowly start to lose density or strength. The density of your bones is affected by heredity, diet, sex, hormones, physical activity, lifestyle choices, and the use of certain medications. Most people don't know they have decreased bone density until they get tested or they break a bone. A bone mineral density (BMD) test is the best way to check bone health since osteoporosis is basically a silent disease. Osteoporosis causes the skeleton to weaken and the bones to break. It poses a significant threat to more than 2 million men in the United States. 1 in 4 men over age 50 will have osteoporosis-related fracture in their remaining lifetime. But men don't get osteoporosis as often as women. That's because men have larger skeletons, their bone loss starts later and progresses more slowly, and they have no period of rapid hormonal changes. Hypogonadism is widely considered to be an important cause of male osteoporosis, occurring in up to 20% of men with vertebral fractures and 50% with hip fractures. It's of note that as testosterone plays an important part in maintaining a man's skeleton, it also improves bone density in men with hypogonadal osteoporosis. Testosterone is known to decrease bone resorption and stimulate bone mineralization. Treatments with calcium plus vitamin D and bisphosphonates are widely used in men when osteoporosis is documented and hypogonadism has been excluded. Because there is a lack of information about male osteoporosis, there is not a lot of communication about how to handle the disease, which is a debilitating side effect of testosterone deficiency. It is practical for all men beginning testosterone replacement to receive calcium and vitamin D and maintain a reasonable exercise regimen. Baseline BMD and follow-up bone density measurement are appropriate with consideration of biphosphonate treatment as a possibility for those men developing osteoporosis.